Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common condition we treat in the office is tennis elbow, or also known as lateral epicondylitis. Lateral epicondylitis is when the muscles that attach on the back of the wrist and go to the elbow there, they become tight and then they become inflamed and irritated, and it causes pain anytime you're gripping or anytime you're using that right arm. So I'm going to show you 3 exercises that we can use to fix the lateral epicondylitis. The first exercise we're going to do is called an isometric exercise. And in this exercise, what we're going to do is we're basically, if I want to treat my right side, we're going to put the wrist into extension. And what I'm going to do is I'm going to apply a little pressure on the back of my wrist as if I'm trying to pull my wrist down, but I'm not going to allow my wrist to move. And so what I'm going to do is I'm going to apply about 10% of my power trying to push my wrist down, but again, I'm not going to let my wrist move. And what that's going to do, it's going to help to strengthen the tendon of the elbow right where it attaches. And so again, I'm just going to apply the pressure for 20 seconds, hold. Good, not allowing my wrist to move, just maintain that pressure for 20 seconds and then relax. And then I'm going to repeat that again and do this isometric again. We're going to contract for 20 seconds and then relax. Next, what I want to do is, as that feels okay, there should be no pain while we're doing that, then I'm going to bring my wrist into a slight flexion a little bit further down. And now this is the new starting point. So again, 20 seconds here, hold, hold, and then relax. And then repeat that again, contract, relax. Now you maybe only go to this point before it starts to cause pain, and that's fine. So that's your starting point. But eventually we want to get to a point where we're all the way flexed forward and then resisting at that point. That's going to be the most stressful for that elbow, is when you're fully flexed, and even extended out is even more difficult. But what I want to do is I want you to start here and then slowly kind of work in angles as you go further and further down. The second and third exercise are going to use what is called a flex bar. You can buy this on Amazon, and it's by a company called TheraBand, and it comes in different strengths. It's yellow, red, and green. And what I would recommend is either the yellow or the red one, depending on your strength you have in your forearms. And so what we're going to do is we're going to use this to eccentrically stretch out this part of the tendon. And so what we're going to do is we're going to twist the bar, which is going to add some load to it. And then we're going to straighten our arms, and then we're going to slowly let the right arm relax. And what it's going to do is it's going to pull that wrist down into flexion, which is going to help to stretch out this part of the tendon. Actually feels really good. Again, so you're going to start with like a neutral grip. We're going to kind of twist the top part to load some tension into the bar, and then we're going to slowly let that right arm relax, and it kind of goes along for the ride and flexes forward. And then again, I feel a real good stretch right here in the tendon. So that's the second exercise. And what I would do is I would do 2 sets of 10 repetitions with this one. And again, we don't want to do this if this causes any sharp pain. So if you're feeling pain, just discontinue the exercise and wait till it's healed up to a point where you can actually do this. But this is a great preventative exercise that you can do. The third exercise, we're going to loosen up the jar and we're going to tighten the jar. So in this case, we're going to turn the flex bar vertical here, and then we're going to try to pry that cap off that jar like that. And we're going to do 2 sets of 10 in this direction. And again, you're just basically trying to turn that bar towards you, try to release that cap on that jar. Good. And then we want to tighten the jar and go the opposite way. And again, what this is doing is it's strengthening that tendon right here so it can repair itself and loosen up and take the pressure off that area. Good. And then we're going to do 2 sets of 10 and going in this direction. Again, I should not be feeling any pain at this point. If you are, just to discontinue the exercise and then build it back in once you don't have pain. So those are 3 exercises that you can use to help fix lateral epicondylitis or tennis elbow. If you have any questions, give my office a call at 703-912-7822, or you can schedule online at novachirowellness.com.